Hello everyone, I'm Mary Rose Corrigan, Public Health Director for the City of Dubuque with the December 2023 pre-holiday Public Health Update. It's been a little over a year since I last gave an update, which was all about COVID-19. Today I'm going to provide some information on influenza, RSV, respiratory illness in general, and yes, a COVID-19 update. Unfortunately, I don't have exact data to provide. COVID-19 is no longer a reportable disease. With the ending of the state and federal public health emergency declarations last February and May, we no longer know the number of COVID-19 cases, local deaths, or where outbreaks are occurring. We have limited data on COVID-19 vaccinations and availability of testing and treatments, along with hospitalizations and actual cases, and less information on newly emerging variants. But I am able to provide information to help you make sound choices for yourself. First of all, we have 3 new fall 2023-24 vaccines for COVID formulated for some of the latest variants. One of which, Novavax, is a non-mRNA version, providing a choice for those who want an alternative to mRNA vaccines. Will the vaccines prevent 100% transmission of COVID? Not always. They're not perfect, but they will greatly reduce the severity of illness and the possibility of death. I recommend everyone 6 months of age and older get the latest COVID-19 vaccine, known as the 2023-24 COVID vaccine. Check the website vaccines.gov to find out where you can get your COVID-19 vaccine. Most insurances are covering the cost, and even if you're uninsured, you can get the vaccine free at Crescent Community Health Center, the Visiting Nurses Association, or some other local pharmacies. Check for the Bridge program when looking at vaccine.gov offerings for uninsured individuals. So what if you've already had numerous COVID boosters or have had COVID-19? Getting a COVID-19 vaccine after you recover from COVID-19 infection provides added protection against a virus that causes COVID-19. You can still wait about 90 days before you get the vaccine. The bottom line, people who already had COVID-19 and do not get vaccinated after their recovery are more likely to get COVID-19 again than those who get vaccinated after their recovery. And this fall has produced plenty of other respiratory illnesses which are not prevented through vaccines, such as rhinovirus and parainfluenza. These viruses cause various forms of the common cold. The best way to protect yourself from these and prevent their spread is frequent hand washing, covering your cough and sneeze, and staying home and away from others when you have respiratory symptoms and are ill. If it's one thing we've all learned over the past 3 years, it's showing courtesy to others by not going to work, activities, events, or family gatherings if you're sick or not feeling well. The other respiratory illnesses to prepare for are influenza, or the flu, and RSV. Exposure and transmission of these viruses was almost non-existent for the 2020 and 2021 seasons, but last year they reemerged as everyone went back to normal activities without COVID-19 precautions. Is this caused by immunity debt? That's the newest term to describe why we had the upsurge in RSV cases last fall and winter. RSV typically affects infants and very young children, but also impacted older adults significantly. Because overall immunity waned due to the decreased spread of RSV and resulted in the current immunity debt, we saw a big spike in cases last fall and winter, many of which required hospitalization for babies, young children, and older adults. Was the lack of RSV and influenza cases during the 2020 and 2021 respiratory seasons due to lockdowns and other public health measures? Probably only partially, since COVID-19 was still being transmitted rampantly and the actual lockdown didn't really last long. Also, remember, we still had a lot of essential workers and places of business open. Or was the surge in RSV due to the COVID-19 virus' ability to override those viruses through viral interference? We don't know the answer to that yet. Regardless, what you need to know is that this year new RSV vaccines are available and recommended for people 60 years and older, particularly with underlying health conditions, and also for pregnant women during their pregnancy in order to protect newborns before they can be vaccinated. Check with your doctor to see if these new vaccines are right for you. And since we all probably have immunity debt from less influenza cases the past few years, influenza vaccinations or flu shots are more important than ever. So get your flu shot. It's not too late. A couple of wrap-up points. Free COVID-19 test kits are still available by ordering them through covid.gov/tests and also through testiowa.com. And if you have expired test kits at home, check the QR code on the box before throwing them out. A lot of test kits have an extended shelf life and are okay to use. If your at-home test is negative and you have symptoms, test again in 48 hours. Test Iowa uses mail-in PCR tests and are more reliable, but take a day to get results after you mail them. Also, you may want to follow up with your healthcare provider to get checked for influenza or other respiratory viruses. Since COVID-19 is still here and our hospitals are currently treating a significant number of people for COVID, remember to stay home when you're ill, particularly with respiratory symptoms that are so easy to spread. And if you're absolutely not going to get an updated 2023-24 COVID vaccine, at least take a COVID test if you have symptoms. Remember, it's not about you, but those around you. Thank you for tuning in. Stay healthy during this busy upcoming holiday season.